Artificial heart valves have been evolving over the past several decades, and there have been many firsts. The most recent is the government approval of the Sapien transcatheter heart valve. The valve's approval brings a treatment option to some patients who have severe aortic stenosis and are too sick to undergo heart surgery. The valve is implanted through percutaneous routes, including transfemoral or transapical approaches, but some questions are yet to be answered.
I think that what's going to happen, and the debate is going on right now, is will the FDA allow this to come out to anybody that wants to do it? Are they going to say no, only certain centers can do it? Are they going to say that you could put it in any patient? Or are you going to limit it to the sick patients that we currently are dealing with maybe some flexibility in that group of patients?
Dr. Paul Corso is one of the investigators in the clinical trials for the Sapien valve at Washington Hospital Center. The center started performing the procedure in 2007.
The fact that we are a high-volume program for this particular study, and we still are learning things, tells you that every hospital probably shouldn't do this.
Device maker Medtronic is also conducting a study putting to trial its core valve. What's unique about both brands of valves is that they require multidisciplinary heart teams and a hybrid OR or a hybrid cath lab. And to some, this is revolutionary in a field that subspecialties have had their share of turf wars. Dr. Augusto Pichard is one of the investigators for the Sapien valve trial, which is better known as the PARTNER trial.
This trial is changing medicine altogether because it's proven that a multidisciplinary collaboration is indispensable. So we've been very successful because we have a very close collaboration, heart surgeons and cardiologists, but also non-invasive cardiologists, also clinical cardiologists that evaluate the patient, anesthesiologists that handle all the anesthesia component of the procedure, vascular surgeons who help us with vascular access, or when there's a complication to solve the complication, interventional peripheral cardiologists who also help us with vascular issues. So it's a true multidisciplinary team. And those that don't have access to such collaboration will not be able to be successful handling these patients.
Meanwhile, some experts say that there is no guarantee that the concept of heart teams will go beyond centers performing the procedure. But there are signs of a movement toward collaboration between cardiologists and heart surgeons. National heart organizations, including the American College of Cardiology, are for the first time introducing the concept of a heart team approach to determine the best treatment for complex coronary artery disease.
This is just the very beginning, and that we will be working toward new technologies that will benefit the patient, and that we feel that we can do that because we do work together, and we're not going to have turf wars that will be to the detriment of the patient.
This is Nasim Miller.